All right. Good afternoon, everybody. We can take our seats if we need to. We're going to call the meeting to order. It is 12:33 p.m. I know we've got at least one more board member who's going to be arriving shortly. Let's see. Ann, do we have a quorum?
We have a quorum of 7.
Okay, very good. And we're joined online by Commissioner Kearns. And so we'll look to see if anybody else happens to join online as we move along. Is there any citizen input that's on the list?
No one signed up for citizen input.
All right. Well, with that then, we will move to our board reports. I don't have a whole lot to report for the chair's report, so why don't we just move into committees. Patricia, is there anything on the facility side that you would like to update us on?
I just have for the consent agenda, so I'll wait.
Okay. Commissioner Waldron, I assume there hasn't been a meeting of the Policy and Education Committee?
No, but we are planning one. And do we have a meeting date? I think it's on
August 19th?
August 19th. So members of the Education and Policy Committee, August 19th, we'll have our first kind of regrouping meeting to talk about legislative agenda items or other policy or education items of interest to the committee. So I guess let me know if you have agenda items you'd like to discuss. And I can't remember who our committee members are offhand, but if you are a member, reach out at least a week in advance, right? If we want to have items on the agenda. Okay.
Okay, thank you. And Budget Committee, there is nothing fancy. I don't think Commissioner Brooks is on or with us today, so we just went through all of our financial reports, some of which we will go through here a little bit later, but there was nothing in particular to call out there. So I do want to welcome, we've got a couple new board members. Nathan Syjon, welcome. Thank you for being here. And you're from the Healing Lodge of the Seven Nations, correct? Awesome. Is there anything you'd like to just say as a new board member?
I just appreciate being here in the space with you guys. It's very honoring to be able to represent not only my tribal community, but our tribal organization and represent the youth that we serve. So thank you.
Very good. Welcome. And then we are also an additional board member not here today is Commissioner Al French. And so he has been assigned, and I believe that means the entire complement of the county commissioners are now on the Board of Health.
We're all here.
That's right. All right. Well, very good. Okay, with that, we are going to move into our consent agenda. Can I get a motion, or is there a motion related to the consent agenda?
I move that item 5C, contract for Garland Roofing, be moved from the consent agenda for separate discussion and action.
Okay, that's well taken. We've got a motion and a second. Is there any discussion of that set aside? Seeing none, all in favor of setting that aside, say aye.
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 Any opposed? Abstaining? All right. Can I get a motion to adopt the remainder of the consent agenda?
So moved.
All right, motion and a second. Is there any discussion? Seeing none, all in favor of approving the consent agenda as proposed, say aye.
Aye.
Aye. Any opposed? Abstaining? Okay. Related to item 5C, is there a separate discussion or motion related to that?
Yes, I have a motion. I move to remove item 5C from consideration by the board at this time and refer the matter to the Board of Health Facilities Committee for review of alternative roof repair options for the College Avenue building. The Facilities Committee shall evaluate the alternatives and return to the board with a recommendation for further consideration and action.
Second.
Okay, motion and a second, and we're joined by Derek Baziotis. Thanks for joining. Just so you know, we've just approved the consent agenda, and right now we're considering, we set aside 5C, and we're just considering a motion to refer it back to the Facilities Committee for further discussion. So is there any further discussion of this item? Commissioner?
So I read the background on it, and I see that the bids came in really high. So when did we actually put out the request for bids? Just wondering, I didn't see that in the background document.
We put this out, this is actually a different procurement method than a traditional request for bid. We went out as an Omnia contract. So we've been working on this project over the last month. I think bids were due 2 weeks ago, and those were presented to us on Monday of this week. Just a little bit of a brief backstory on this project. We were expecting bids to come in around the $550,000 range. Unfortunately, the bids we received back were, the low bid was $835,000 all the way up to close to $1 million. At this point, you know, that extra cost doesn't really represent extra value to the district. There were a number of things that influenced that extra cost, including, you know, the price of petroleum-based products, and then we're kind of trying to squeeze it into a weather window right at the end of the year, so
That's
we
why I
didn't
was
get
asking,
the
because I'm
amount.
thinking a lot of those companies are doing work right now.
Yes,
So,
yes,
yeah.
precisely. So we do have some other options available that I think are appropriate to discuss with the facilities committee that might bring more value to the district. This is one of those things that, you know, if you guys feel that we need to move forward with this, I'm in full support of that, but I think there are better options that provide better value at this time than moving forward with the project at the increased price point. So.
Very good.
Yeah, that was just my thought, that sometimes, you know, at the city, when you put out a bid at the wrong, sometimes timing is everything. Although there are other influences, I'm sure, on the cost of the products right now. But yeah, I fully support the motion for the committee to look at other options, or maybe another time to a better timing on the bid requests.
And Travis, do you know, is there a likelihood that, you know, international affairs, as they change, these prices might come down, or do we think this is just going to be the new normal?
That's really tough to say right now. In the construction industry as a whole, we've seen price volatility to the, I mean, it's the worst that I've ever seen it. And that's not 100% due to materials. We have a really unique labor market right now for these skilled trades. There are a lot of things that go into that. What I'm proposing is that we take this back to the facilities committee. We evaluate some other options. There were other options on the table when we decided to move forward with that one. We can pursue some coding options that, while they may have changed in price also, we may be able to get back to a better value for the organization. We also have some options to look at doing part of the project this year to make use of some ARP funding that's left over, and then maybe push the majority of the project to a future year when we can have a little bit more time to get more competitive bids and find a better value.
I think that's great.
Yeah, and I think my concern would be, at the committee, we discussed the ARP funds that we needed to get
Yes.
this project rolling.
Yes.
So that would be my only concern is, that's an outrageous, but we also need to get those monies flowing.
And
Yeah.
we definitely have some ideas on how we can spend those to add value to this project, whether whichever option we choose at the committee's discretion, we could move forward with and still get those funds spent by the end of the year.
Is there any other comments, questions? I'll just throw out, and I mentioned this to Commissioner Jordan, obviously we have other projects too, and so if in fact we're not going to pursue this project this year because of the cost, we don't want to just overspend for the sake of overspending, maybe the commissioners could consider reevaluating the dollars and broadening the allowable use. And so we could use those for other projects, potentially. We just have such a narrow window. Okay, with that, we've got a motion and a second to send this back to the Facilities Committee, which I think the next meeting is August 11. All those in favor of the motion, say aye. Aye.
Aye.
Aye. Any opposed, abstaining? All right, that carries. Do we need to go into an executive session, Michelle?
We do not, thank you.
No. You're shaking your head no?
Are you able to hear me?
We can't, it's very low, but you're saying no. Okay. All right, very good.
Whisper.
So let's move in then to our agency reports. I know some of these are written. I do want to check with Dr. V, our health officer. Is there a presentation or anything to present? If you'd like to go ahead.
So good afternoon, everyone. I feel like I have to yell from here. Hold on. Let me advance the slides. So I do have a presentation which is in your packet. I'm not going to go through all of it, but I do have a couple of updates and some key points to pull out for you just as you review the presentation again later. So we're going to talk about some communicable diseases and some animal bites. Summers, so bugs and bites are very common. And then I have a slide on community collaboration, which I think is quite unique. So a little bit of context. As you know, we have been dealing with an Ebola outbreak since May, specifically centered around the Congo, the Democratic Republic of the Congo, which is that bigger map hold on, that you see over here. And I bring that to your attention because it's centered around mainly two provinces, where we've seen the vast majority of the cases. Now, the numbers that are there are a couple of weeks old. The numbers right now are up to about 3,262 with 1,434 deaths, so it's getting close to the 50%. The country that you see right next to it is Uganda, and I bring that up because that is the second site where we have a ripple from that outbreak, although the good news is as of the 28th, which was Tuesday, also my wedding anniversary. So it was good news for that. They have declared the outbreak to be over. 2 consecutive 21-day incubation periods for 42 without any new cases. So we can say Uganda is off the books right now in terms of the outbreak. Now, the reason why I bring that up is because we still have questions about do we have any cases in the U.S. or not? And the answer is no. We did have a case in an American citizen that was moved to Germany for treatment, a physician who did missionary work. And the second case, international, not within the confines of the regions that we just described, is a French citizen, also in a missionary mission to very close to the DRC. The 2 bullet points at the bottom are probably the 2 most important. Number 1, we have not confirmed any cases of Ebola in the U.S. related to this outbreak. And number 2, the overall risk to the community remains low. Now, as I mentioned the last time, we do have a travelers program where we identify people coming from regions that may be associated or geographically associated. And we've had, at the time that I made the slide, we had 7, now we have 9 citizens from Spokane County. The last 2 will finish the monitoring mid-August. Again, low risk, not a significant risk. This is mainly for awareness, not to be alarmed, but just to be aware of where we're at with that. More than likely, we'll continue to see occasional cases that need to be monitored, and the monitoring is self-monitoring for 21 days. We make contact. We're required to make contact once a week. We actually make contact twice a week just to make sure that we shorten communication in the event that there are any changes in symptoms. So with that, I'm going to move on to the next item, which is West Nile virus, which is also active at this time of the year. And just as a reminder, is a leading cause of mosquito-borne disease in the U.S. Humans are considered to be what is called a dead-end host. It can't really reproduce inside us, so we don't transmit. It's all mosquitoes. This is typically the life cycle. The reason why I put this picture is a reminder that it can infect other animals other than humans. And actually, if you look at what we have around the country, that was the time when I put that slide together. Now the number that is up there is not 56, actually 113, with 23 states, and there's 61 of the cases are in the state of Arizona, which is the state in the purple down there. So a lot of the cases are in the state of Arizona. Now, in the state of Washington, we do surveillance, and those numbers will be updated as of yesterday, where we do have 25 mosquitoes in Benton County, 1 bird, Grant 6, Yakima 11, and you continue to see the 1 person over in Thurston County, which is a Thurston County citizen, but was exposed in Arizona, not in the state of Washington. So by now we have, like I mentioned, 113 cases in 23 states around the country. Now, the other area that I wanted to share with you is we continue to do surveillance. We'll do surveillance again next year. And if you're not familiar with mosquito surveillance, we actually capture the mosquitoes and test them genetically to see their potential carriers. If they are, then we test them for the virus, okay? Just to be, in case you don't have that background. The other item that we're following is Rocky Mountain spotted fever, also seasonal. Could be a significant life-threatening illness transmitted by ticks. And as you know, there are a number of ticks that can do that. So one of the areas that we like to highlight is that it's treatable if caught early, and it's treatable with antibiotics, and people tend to do well if we treat them early. If they don't, it could be quite severe, requiring everything from mechanical ventilation to transfusions, etc. Now, I want to highlight if you have any of the symptoms, this is one of the questions that comes out from the community. When should I either call my doctor, or go to the emergency room, go to the urgent center? And I think if you have any of the symptoms or a combination of the symptoms, high fever, hemoptysis, which is coughing up blood, swelling of hands, feet, severe stomach pain, not consistent with any other issues, confusion, seizures, numbers of weakness, or severe vomiting, please go to the emergency room as quickly as you can. Now, we do identify ticks and or cases that may have been exposed in Spokane County. 25 and 26, both years, we've had about 3 of those. We have one from not a county citizen that was exposed in the geography that I have up there. I think it was hunting or one of those activities. But something that we do track, and we will do what's called dragging, which is capturing ticks and doing the same type of analysis that we do for mosquitoes. So more to come on that, and we'll continue to do this as, for however long we can over the next few years. The last thing I want to talk to you is about animal bites. We've had, if you look at that line that went up, came down, the lighter orange actually is going back up again. When I update the slides, we had 16 calls in the last week alone. And they're typically related to people coming in contact with bats. And if you have been following the news, we had a news release about the first bat that was identified as having rabies in Spokane County. And I do want to say that was on the 27th, that this is someone observed the bat acting batty. And
Oh, my.
well, that's what they say. I'm quoting. What can I say? No, the bat was acting unusual. So the citizen actually captured the bat, submitted, and it turns out the bat was positive for rabies. That's great, but I will caution people not to come in contact with bats if at all possible, and call us, call animal control. We'll certainly do that, and bats do get captured for surveillance and so on and so forth. I did hear an interesting story about children, and the reason why I bring it up is because many times most of the contact that we hear is about children. So there were some kids that thought it was cool to play tag or catch with a dead bat, and I will really warn people against that. Because remember, all it takes is a scratch and or contact with saliva of the bat, even if it's dead. So bats are their natural reservoir, so I'll encourage everyone again, there are ways to get rid of bats if you see one or if you're concerned about one. Now, I don't have cyclosporiosis here, but since people have been asking about it a little bit, that is the GI disease that is running around the country. We've done a number of interviews about it. By now, we have about 18,000 suspected cases, 6,700 confirmed. Michigan has about 10,000 of those. And when you look at Washington State, we do have a few, 42 of them to be exact, 28 international travel, 10 with travel to the states in which the outbreak is occurring right now. Nothing in Spokane that we need to talk about, but it's something that we'll continue to track. And then last thing, which is a new thing, early in July, hey, what happened to my picture? Oh, there it is, sorry. We opened a WIC facility or WIC office at Maddie's Place, and that was to complement the services that are being offered there. So that's the person in the center is Mary Wood, the program manager, and then Shelley, who's one of our certifiers. In the bigger picture, we have the staff from Maddie's Place. So I had the pleasure of being there to say hello to the folks there. So with that, I'm gonna stop here and see if you have any questions for me.
Are there any questions for Dr. Velasquez?
Lois, what was the national number for the parasites?
Tuberculosis. The national number is 18,000 suspected, 6,700 confirmed. Michigan has 10,000 of them. And we don't have completely identified the source, but in previous outbreaks, things like lettuce and basil are typically the culprit, and I know there's a lot of talk about lettuce. So, and we do have some guidance in our website about buy the whole lettuce, remove the outer layers, so, and wash everything really well, which you should do anyway, so.
Is this in our U.S. food supply, or is this imported food? Or?
So one of the items under consideration is lettuce coming from central Mexico, and distributed number of fast food and other large quantity providers. If you go to supermarkets here, or if you go to some of the markets around, people are identifying where the lettuce is coming from locally, so that's to give you an extra layer of protection. Now, we have not confirmed that it's lettuce, but seems to be highly suspect just because of the number of cases related to particular establishments and the consumption of particular items which have lettuce.
So not really associated so much with the grocery stores as it is with food that is being purchased by?
Well, the reality of the matter is cyclosporiosis can be seen every year, even locally, a small number of cases. And although right now we're looking more at imported, I think it's important to know that we do see some cases anywhere in the country, including here in the state of Washington. So the precautions about buying whole lettuce, peeling out the other couple of leaves and washing every leaf, that applies. I will do that no matter where you get it from, just to be on the safe side, because you cannot guarantee 100% that is all from exported produce.
Like vinegar denatures it, or soap and water, or?
So that's a great question. The only thing that actually inactivates the parasite is cooking at 158 degrees or more, so stir fries are a good way of doing it, because particularly if you have an induction stir fry, because that gets to 160 fairly quickly. Freezing, we do not recommend using detergents or anything to wash, because first of all, that's kind of toxic, and second of all, it doesn't do anything for the parasite. Refrigeration, freezing doesn't inactivate necessarily. Neither do typical things that people may use like vinegar, etc. Cooking 158 or higher is the only thing that will actually destroy the parasite at this point. Great question.
Well, I'm not a fan of stir-fried parasites, but others may be, so.
No, I mean stir-fried vegetables.
That's right. If there's not anything else, we will move along. Kim, did you have anything to present, or is it just in the packet written?
It's in the packet.
All right.
I can just quickly share. Thank you to the board members that attended the audit entrance conference yesterday. Appreciated your attendance, and there'll be a packet sent out to all board members. Just to recall, the audit started middle of May. This is the audit entrance conference to talk about what they would be looking at. They're reviewing the WIC program, our financial statements. and the WIC program is the federal single audit. So conclusion of this meeting, Ann will facilitate sending the full document to all board members. And then at the conclusion of the audit itself, we'll have an audit exit conference. Otherwise, all the financial documents are in your packet, but that's be an update. And we're also working very actively with managers and directors to develop our 2027 budget right now. And we'll look forward to bringing that to Budget and Finance in September meetings for committee, and then to the full board the end of September.
All right. Well, thank you, Kim. And
Yeah.
I had the opportunity to participate in the separate audit interview last week as well, and I think it all went very well. So we will then go to our administrative officer. Danny, I know your report is written, but you've got some kudos for our employees.
Yeah, this is a good part of the job that I like to do. We have a handful of people. These were nominated by certain people. And the first one is Amy Jennings, who works in our comms office. Amy got kudos for her graphics and ensuring the materials look amazing, according to this. That she's also wonderful to work with and very patient. And I can certainly attest to that. My work with Amy has been wonderful. She's very creative and a big help to the agency here. Amanda Duggar, I'm sure some of you all have heard her present. She's obviously quite passionate. She's a wonderful employee here. And she got kudos for her collaboration and support of a wellness day at one of the schools. And the student feedback as well as the teachers was very positive for her. Stacy Lachaux is one of our managers here and quite the up-and-comer. And I've been very impressed with her. Her kudos comes from her professionalism and diplomacy in building and maintaining strong relationships within people that are in our office. Mia Parker is another one of those employees who is quite passionate about her work and does a great job. Molly Cavino at Northeast Tri-County Health District gave her kudos for the job facilitating a life course game with the Wellpoint School District. And the final one, our HIV case management team. The entire team came together to complete the first ever analysis of our annual CT survey. They identified a lot of opportunities there, and we were very pleased with the work that they had done there. So I see Brian back there nodding like he thinks it's right.
Hey, well, thank you so much, Danny, and great job to our employees. It's really nice to hear. We are going to move into our agency report. We've got Misty Challenor here for a treatment services update. Misty?
Good afternoon. So you have the quarterly report in your packet. I won't belabor since it's already all there. Just to give you a high-level overview, this last quarter we did some realignment of our hours just to make some adjustments to meet the needs of the patient population and ensure that we were still meeting the needs and adhering to what we could manage within our staffing. And with that, I think that really did meet what our community needs were at our current capacity. Additionally, we have been working on an implementation on a new electronic health record system. And while we initially had hoped to go live with that EHR on August 3rd, with ensuring that we are effective and doing that strategically and making sure that all staff are prepared and that that system is ready to be active with as minimal issues or hiccups as possible, we wanted to make sure that that was prepared adequately. We have actually pushed that back to October 1st. Just to be as thorough as possible. So we will be doing that here in the fall. And I think that will make a stronger transition and have fewer issues, fingers crossed. We know with any electronic system, there's inevitably going to be some issues, but hopefully that will minimize that issue at that point. Additionally, we have been collaborating recently with our syringe services program, and next week we will begin a new project where we will have treatment services staff on site on Tuesdays to have the opportunity for any individual arriving within syringe services to meet with one of our staff to begin the intake process here. And that way, when they identify the fact that they would like to enroll in services, they can do so right then and there. And then the fact that transportation is already here and available, we'll be able to transport them over to our 8th Avenue location to enter in and begin in medication services. So that will begin next week, actually. And then we're going to be evaluating what that looks like, what effectiveness, what adjustments we need to make with that. We've been working with Brian and his team, Sam Carroll. So we're pretty excited to see what that does and how we can meet the needs of that population as well. So that's kind of a new exciting project that we're just getting launched next week. So additionally, one other final point I wanted to address is we did have an audit come through 2 weeks ago with the Board of Pharmacy, and we had 2 minor things that came through, but they were remediated immediately, and everything else was beautiful, and we are adhering to every other rules and regulations as necessary. Questions?
Missy, I
Yes.
just want to say I really appreciate this new program project. I think that makes a lot of sense to try to get folks into treatment at the moment in time in which they're trying to get the materials to continue their use. And so, and I love that you're going to transport them on the spot, and hopefully that we will see a lot of success there. And so, anyway, just kudos to that, because I think that is a really smart thing that we should be doing. So thank you. On the pharmacy thing, I am curious, what are they looking at specifically? Is it just controls on protecting medicines, things like that? And if you could elaborate a little bit more on kind of what it is that they identified that we've corrected.
Yes, so the Board of Pharmacy looks at, to your point, the controls and the safety and security. They work alongside essentially of DEA, and what it is that making sure we have the prescriptions, the labels, the securities for the medications, our security controls for the entrance into the dispensary, the entrance into, and the security measures on the safes, our diversion control plans, those types of things. And they make sure that all of our policies, procedures, our staff access, all those pieces are in alignment with all of the state and federal regulations. As far as the pieces that they wanted us to make adjustments on, it was the 2, I'd say loosely, minor pieces where they wanted us to reevaluate who had access, and the fact that we needed to ensure that we were printing hard copies on a daily basis of our dispensing records, because we were keeping them just strictly in our electronic health records. Even though we have access to that, they just wanted to make sure we were printing them on a daily basis.
Okay, but they didn't find that anybody accessed it, then they shouldn't. It's just more about controlling moving forward. Okay,
It was just those 2 items.
great.
Yes.
Any other questions for Misty? Danny?
I'd like to say that one of the things I identified quickly when I came in is because of the lack of leadership in my role, there had been not a lot of departments working together. And this syringe services is not under Misty's purview. She and Dr. Velasquez and I met together, and I was really pleased with how creative and how quickly we came together with a solution that I think will increase the census of the people that are there, will offer treatment to people who are in our syringe service program when they're ready for it. We didn't spend any money doing it, and I kind of told Misty, we don't have a lot of money. How do we do this the right way? Her team came up with some pretty creative ideas. I was very pleased with that.
Great.
And thank you. And to that point, I really want to hand it to Sam Carroll and Mimi Berlinger, the 2 of them from Brian's team and from mine. The 2 of them have been really great about jumping on this and really coming together to make sure that this happened and happened quickly.
That's wonderful. All right. Well, thank you so much. Nothing else from anybody? Okay, we'll move on to our last agency reports, a TB program update from Brian Wan.
Good afternoon, members of the board. I'm Brian Huan. I am the new program manager for the TB program, as well as the HIV STI and our syringe exchange. Included in your packet is a detailed report of the current state of our TB cases here in Spokane County, but also sort of the initiatives that we have in place to ensure that we are functioning effectively within our program. The highlight of our summary is that we are currently managing an increased number of cases here in Spokane County. However, I do want to emphasize that this is not an outbreak, but through the work of our team, we're effectively making sure that patients, our clients, are getting into treatment. We do have several initiatives in terms of that we're working on to ensure that we are efficient in our work, but also ensuring that we are mitigating costs. In your report, you'll find that with our cases reaching end-of-year cases of last year as of June 2026, our cost has definitely increased a lot, and some of our strategies moving forward is ensuring that we mitigate those costs moving forward. But happy to answer any questions you folks may have regarding our current TB programs and efforts.
Any questions, Commissioner?
So the county commissioners, part of the funding that we contribute to the health district goes directly to the TB program. And so over the last couple of years, just for context for new board members, we've had to increase that amount of money.
Yes.
Because we've seen an increase in TB cases, and they're very complex to manage, and they need registered nurses, right, to be administering treatment.
Yes.
So how is that going with, I know it took a while to hire another full-time nurse. So last year there was a lot of overtime till that person got on and trained. So now this is the first year that you have 2 full-time RNs, or 3, sorry, there was 3, we added 1.
Yes.
So how is that working to manage the caseload? How are you, it looks like that we're within the year-to-date budget, just barely, but that's good. So congrats on managing the budget and hopefully managing the case as well.
Yes, so actually we've been very fortunate to have had our new TB nurse start in mid-May. I did anticipate sort of our caseload to be a little off, given that there is going to be time needed to ensure that we do proper onboarding and coaching. As you can imagine, learning case management isn't a course. It's really these elements of factors that we have to consider when we have our clients, especially in these high priority populations. And so as we develop our standing orders, we put in place that, part of the technical skill sets that folks should have and the case management skill sets should take about 6 months. So we did anticipate some level of lack of capacity. However, I was very impressed at how quickly the team was able to sort of galvanize around that, continue the training while maintaining capacity over time. As you can see in the report, our overtime numbers were pretty high. When I look at it on a month-to-month basis, that those numbers started increasing in January up to the point that we took on our new nurse in mid-May. One of the success stories of that was our team members was able to finally get time off, because that was what I was making sure that they happen, was our team members are working over the weekends and the evenings just to ensure that they're catching our clients. So that was our success story there. Overall, though, as we refine and complete our standing orders, what we're hoping is to improve those efficiencies. As you can imagine, with routine tests for imaging and whatnot, sometimes weekly, sometimes monthly, it does overburden our health officer to sign off on those. So these standing orders will hopefully mitigate the back and forth and the waiting to ensure that a continuity of care happens right on the spot. So definitely a lot of ways that in our strategies to ensure that we are mitigating those costs over time. We do anticipate to at least meet budget, if not go a little over. However, we're hoping that through some of these mechanisms, like ensuring that we have a process to bill clients' insurance rather taking on those costs, are things that we're actively working on now.
So, so we're not billing insurance right now for any of the costs?
Currently, it was not something that we're doing, and in the past, because our case numbers were fairly low and not as complex, those costs were actually very minimal. But now, as we're seeing cases increase and complexities increase, that's where we're projecting if we don't put these measures now, we will go way over budget. I'm anticipating if we don't have these things in place, it might be over $50,000 on that category alone, so.
And we have the capacity within the district to do the billing, the medical billing.
Currently, that is one effort that I've been strategizing on, and so.
I know we do in Misty's shop, but I just didn't know if that could be useful.
It definitely can be, and so as you can see in the report, there are elements where my entire FTE, Dr. Velasquez's FTE, is not being coded towards the TB county, and one of the ways that we're looking at how to support our efforts is looking into our administrative assistant who can put maybe a 0.1 FTE into coding into TBs to maybe help with some of the navigation and or connecting the dots for us. However, the good thing is our nurses are doing what we call the Medicaid match coding, so there is some level of cost that we're recuperating to get that 0.1 FTE not covered by the county, but rather things that we're actively doing already. So.
It's just a preview of questions I'm sure the county commissioners will have later in the year. Okay, thank you.
I have a question. Just, are there grants that are available that could be a possibility as well to help fund?
There are grants, but given the nature, I mean, we also just found out recently that we had a reduction in one of our state or federal grants. So it's just one of those things that one of the things we're monitoring is losing some of our resources, where with the Department of Health, they also had to cut down on their staffing there, which meant that even some of our cases that we're looking for consultation through the state may also be delayed. So every program is feeling the impact. So.
Good. Any other questions from anybody? Commissioner?
What's a reasonable time frame, do you think, for us to get an update on the billing of insurance and whether that's feasible?
We're actively working on it. I'm actually in communication with Inland Imaging. One of the things that we're really working on is what is the appropriate way to share. In a regular hospital setting, this is actually happening where two different entities are sharing information so that we can track what reimbursements have gone through, which were denied, and that we can actively rework them. Internally, we're trying to figure out how to make that work with another entity, given HIPAA, PII issues, but hopefully within a month, I can at least give an update as to how far we've come along. We did initiate at least the process in July 1st, where we had communicated to Inland Imaging that we would like to change the workflow where please go ahead and bill insurance, and if there's any denials, we'll work with them to submit it.
Yeah, I think it'd be good to just hear an update next month if we could.
Of course.
Can I explain that a little bit more? So when you go to your doctor and they send you for an x-ray, you don't get a bill. The insurance gets billed first, and then you get the deductible copay, whatever the excess is. So there's two ways of doing that billing. One is payer, and the other one is direct client. So the Regional Health District has been a direct client on imaging since the beginning, which basically means the provider is billing us, not billing the insurance, and then billing us for the residual that is not covered. So we're kind of rotating that process where it looks more like we're a healthcare facility with a contract with the payer, so Inland Imaging can bill the payer, not us first. And if there's a residual, then we cover that, not the full cost. And the reason why that is becoming more and more important is because if you look at the complexity of our cases, we're going, our volume of high-end imaging like CTs and MRIs is escalating rather quickly. It's not just plain chest x-rays, which are a little cheaper. So as Brian identified all of that, then we started a conversation to go from direct client bill to payer and then residual to client, the way that typically healthcare works.
And we're actively also drafting an MOU or whatever that language would look like with Inland Imaging. So that's already up in conversations with contracts team internally. So.
Yeah.
What do you see as the most of your insurances, are they most commercial or are they private?
Most are either we have uninsured and we do have some that are on Medicaid and whatnot. So those are some of the things that we have to grapple, especially if there's co-pays and or things that Medicaid will not cover. So there's always some other costs as well.
Talk a little bit more about the food costs part.
Yes, so part of the case management is ensuring that we are engaging with our clients to make sure that they're taking their medications on a daily basis. As you can imagine from the populations that we serve and work with, that isn't always the case. There's other priorities that may come into life and whatnot. And so there are elements where we know because of TB and in order to have a successful treatment regimen, we need health, food, and whatnot. And so currently we do purchase food for our clients. However, we're making sure that now with increased costs, we're looking into how we create those parameters. We've actually reached out to Seattle, King County to see what guidance they may have so that we can replicate it and see if we're within standards. But it is something that we're actively working on, and on a weekly basis during our case reviews, we talk about what are the next purchases so that we can deem if it's appropriate or not. So.
Anything else from anybody? I'm curious, and you may not know, but the surrounding counties, like Tri-Health up north, for example, do they have the means? Because obviously the commissioners are funding a lot of this program. Do they have the means to handle TB cases if and when they come?
I would hope or assume so, although because we do have a larger population, my assumption is we'll see most of those cases like Seattle King, where most of the cases will be on that side as well. It's really where folks are and where folks are moving into are some of the things that we're monitoring.
Had a handful of cases that are reside in other counties and the counties take over, but the number is minimal compared to what we see. And we do work with all this surrounding nine counties in the event that, but it's been extremely rare. It's mainly in Spokane County.
Thank you so very much. Appreciate the presentation and the information.
Thank you.
With that, we are at board member check-in. Is there anything for the good of the order from anybody around the room here? Dr. May?
There's been lots of discussions about data centers, I think, that have been going on. Didn't know if it would be appropriate for Spokane Regional to have some role in assessing the community health impacts from a potential data center. Just throwing that out there.
Yeah, maybe a bigger discussion for another day, but I think participation, the city is, we just had this discussion yesterday in our hearing last night, so the city is in the midst of a moratorium for the next 11 months, and we're going to have process around developing regulations, and one aspect of that, I think, is health, and I raised that last night, so perhaps there could be some representation from the health district as a part of that stakeholder committee. I know the county's in discussion. Commissioner Jordan might be able to comment there, but they haven't formalized anything, but it certainly could be a point that they consider as well. So, Commissioner, anything for you?
Yeah, it's ongoing discussion, but I, for one, speaking for myself, would like to hear any relevant expertise that bears on the safety and health impacts. So if there's a specific idea from any board member or management or policy committee or others, then that's something I'd be open to as well.
And I don't know if maybe that should go to the policy committee as just a touch point. Certainly we could touch on it at the executive committee.
Yeah, I would be open to, I can think of some environmental health potential impacts, but I don't know. So I don't know what studies are out there and what other communities have looked at, but, waste issues, noise, any other kind of environmental impacts to human health. So I would be interested in at least starting the conversation and seeing if, and then engaging the health district in any of the local policy.
Yeah.
Because that's where the ordinance, any future ordinance by the county or the city, we'd want to be aligned with whatever impacts to public health or departments here at the health district.
Oh, Danny?
When I lived in North Carolina, the community I lived in, we had Google, a large one there. So, Commissioner, to your point, there are a lot of environmental impacts that have to go into it. Water usage is one, and then when they build those facilities, NEPA regulations because of the moving of creeks and things like that. So there's a great deal of environmental function that's in there. I would see that as a big part of what we would talk about. There are some noise things and stuff like that, but I think to the health aspects of it would be much more environmental.
Well, and if, just informally at this point, if Dr. V or Dan, if you guys have recommendations on the WHO, might be recommended to be a part of these discussions, we can chat about that offline and figure out what next steps could look
I
like.
certainly think that's within Dr. Velasquez's role as the health officer to be part of those.
Very good. Patricia?
I just would be interested if there are any minutes or information from the city council, since I think you've done a pretty deep dive on that. And I thought it was interesting that the council chairwoman said that there are a lot of data centers. There are small data centers and things like that. So when we think about it, we're often thinking about these big things, but we have to recognize that there are a lot of small ones that are already in existence that can be impacted. So if you have access to that information that you want to share with us, either sending it to the board or bringing it would be, putting it in our packet or something would be kind of interesting.
I don't know that we've actually done a deep dive. It's been a point I've raised, but we are going to be doing a deep dive, and so as information comes forward, I'm happy to bring that along. So, anything else? Okay, and I assume we don't have any further citizen input. No one signed up?
Signed up.
No one's online. Going once, twice, 3 times. Okay, well, with that, we are at the end of our meeting. We do have a meeting scheduled for August 27th. Keep an eye out on your emails. It's possible that that is canceled, but at this point, we are maintaining it. And so with that, we will see everybody next time, and we're adjourned.